Vaccinology has evolved tremendously. You'll agree that ever since the advent of vaccines, they have helped save millions of lives. We initially thought this was only with children, but we now know that even adults benefit from vaccines and it helps saves lives of people who may have otherwise died of conditions like influenza and COVID. There have been other uses for vaccines also. Vaccines have clearly helped in preventing cancers. The hepatitis B virus vaccine has prevented the occurrence of hepatocellular carcinoma in millions of patients. We also know that the human papillomavirus vaccines helps prevent the occurrence of cervical cancer. If you look at the recent developments in the field of vaccinology, you will know that there have been newer guidelines in how the vaccines have to be given. Earlier, the yellow fever vaccine, which has been recommended for people traveling to parts of sub-Saharan Africa and parts of South America, was recommended every 10 years. But now the recent recommendations which came a few years ago from the World Health Organization says that a lifetime dose of 1 dose of yellow fever vaccine was enough to prevent yellow fever occurring in people who are traveling to these parts of the world where there is endemic yellow fever infections. Recently, I think about 5 years ago, the World Health Organization also came up with modified recommendations for prevention of rabies. Earlier, the number of vaccines had to be given was 5, but now they've reduced it to 4 doses. Post-exposure 0, 3, 7, and a 4th dose between 14 and 21 days after the animal bite. We have also got the conjugate typhoid vaccine. Earlier, a typhoid vaccine had to be given every 3 years to boost the immunity. But now it is believed that 1 dose of the conjugate typhoid vaccine helps give a prolonged immunity, probably lifelong. There have also been newer vaccines which have come up. COVID epidemic very clearly showed that there have been several platforms of vaccines. The mRNA vaccine has been a revolution, and now several companies are developing the vaccines based on the mRNA technology. Recently, we have also had the introduction of an alternative for the rabies immunoglobulin. When an animal bites, apart from the rabies vaccine, one also needs to give the immunoglobulin at the site of the bite. There were 2 types of immunoglobulins available, the equine or the horse immunoglobulin, which had a possibility of giving allergic reactions. It was less expensive when compared to the human immunoglobulin against rabies, which was safe, but it was prohibitively expensive. For a 70 kilogram individual, the cost for the immunoglobulin alone could be about 30 to 40,000. Now we have the rabies monoclonal antibodies, which work similar to the immunoglobulin and is much less expensive. There have also been other vaccines which have been commercially released. For example, in India, we now have the Japanese bee encephalitis vaccine, which is commercially available. Earlier, this was only through the government setup given during times of outbreaks of Japanese bee encephalitis viruses infection, typically in Bihar and Uttar Pradesh. But now this can be taken by anybody who wishes to travel or is at a risk of developing Japanese bee encephalitis. The shingles vaccine was licensed in India a few months ago. 2 doses of vaccines given 2 to 6 months apart for all people over the age of 50 helps prevent the severity of pain and other complications associated with herpes zoster or shingles. We now have the respiratory syncytial virus vaccine, which is not yet available in India, but was licensed by the FDA probably only in the August of 2023, which helps protect young kids, kids less than 1 year of age if given to a pregnant mother, and also for men and women above the age of 70 who may have severe consequences of the RSV infection. We also have a dengue virus vaccine, which is now available in several countries. It has not yet come to India, but it is a very attractive vaccine to prevent the complications of dengue in children. And surprisingly, we also have a vaccine against chikungunya, which was again unveiled only last year. This was in the USA, and it is believed that this may become popular in the years to come. Apart from these vaccines, there are also several vaccines in the pipeline. A vaccine for malaria, typically for children in Africa who die in thousands following malaria infections, is now will be available shortly. We have modified versions of the pneumonia vaccine. You know, the current pneumonia vaccine has 13 strains in one vaccine and 23 strains in another vaccine, which is less effective. But a newer vaccine, which is going to probably incorporate all these and come up with 20 or 21 serotypes in one vaccine, is looking very promising. And we probably are also going to get a HIV vaccine, though it may take a while. It probably is sounding more attractive as the research progresses. So we now have vaccines to prevent vaccine preventable diseases and cancers, and we are now beginning to use vaccines to prevent the rising tide of antimicrobial resistance. Once people are given vaccines and the herd immunity is increased, by preventing infections, we can ensure that we use less antibiotics and thereby also decrease the people who die directly of antimicrobial resistance, which is believed to be up to 10 million by the year 2050. So please remember, vaccines are life-saving. They are not only for children, adults also need vaccines. Please talk to your healthcare provider and see what vaccines you need and what you will benefit from.